For your most asked questions about novel coronavirus. How do I protect myself and my family?
Clean your hands regularly. Washing your hands is one of the best ways we can to protect ourselves from anything. Cover your mouth when you cough or cough into your elbow. And stay home and stay away from others if you're sick yourself.
Should I be wearing a mask? Is it even helpful?
There's not any evidence that if you're not ill, wearing a mask, particularly wearing a mask outside or out in public, provides much protection or any benefit at all. If you are sick, however, wearing a mask can cover up your secretions so that you're not exposing others, and it can protect others.
How do you become infected with coronavirus? Does that mean I should avoid public areas?
So this is a respiratory virus. So that means it's transmitted to people through droplets that come from things like sputum, saliva, when you cough or sneeze, and sometimes even when you talk. But you have to be really close to somebody to inhale those particles, those little bits of water that contain virus into your lungs. So the only way we get infected is if we inhale the virus into our lungs, deep into our lungs. So you can't be infected for the most part from casual contact or from contact outside. And sometimes people who cough or sneeze who have the virus, those droplets can last for a number of hours on a surface like a table or something. So that's why it's really important to clean high-touch surfaces regularly.
Are you contagious even if you don't show any symptoms? There seems to be conflicting advice.
We do know that in Wuhan City in particular, in those areas of China where there is a lot of people ill and a lot of transmission going on, there may be some transmission from people who have milder symptoms. And as younger people are getting infected, and particularly children who don't seem to get very severe illness with this, and they may be passing it on. What we have not seen, though, is anybody who is not showing any symptoms passing it on to somebody else. There have been one case report in a family where a child didn't seem to have any symptoms and was positive for the virus, but we don't know if that child ever transmitted it to anybody else. So the risk, if it is any at all, from somebody who's not having any symptoms is extremely low, and we don't think that that's a worry for transmission.
Who is most at risk from this virus?
What we're seeing from China is that this virus is probably not causing as severe illness in most people as some of the other coronaviruses, particularly SARS and MERS. And it is causing the most severe illness in people who are older. And the initial cases, it was certainly over 65 and mostly male, but also people who've had underlying illnesses. So for the most part, if you're young and healthy, your chances of having a severe illness with this virus are much, much less.